We welcome you back to In Focus. Now joining us in Focus is our health correspondent, Lenore Modu. Welcome yet again to In Focus, Lenore.
Thank you so much. It's always great to be here with the both of you.
Thank you. What do you have for us today?
Well, today we're looking at bird flu or the avian influenza. And we are going to look at efforts to prevent bird flu in Tanzania. But first, I want to mention prevention campaigns elsewhere in Africa. In Malawi, health officials have begun a 3-day nationwide measles vaccination program for up to 2 million children ranging from 9 months to 5 years old. And in southern Sudan, a mass polio vaccination campaign is underway. Health workers there plan to immunize nearly 3 million children under the age of 5. Now the latest on bird flu. The United States is promising an additional $320 million for the global fight against avian influenza, raising its total pledge to some $950 million. World health officials blame bird flu for the death of more than 240 people worldwide since 2003. The virus remains primarily an animal disease, but it can mutate and infect humans. Earlier this year, Tanzania's government launched a program to deal with a possible outbreak. Herbert Were has more.
There are more than 55 million chickens in Tanzania, and more than half of them are kept locally by 90% of the country's households. Dr. Adela Mroso is Deputy Director of Tanzania's Avian Influenza Emergency Preparedness and Response Plan. She explains the importance of poultry to the country's rural economy.
Yeah, the poultry is a key sector and plays a big role in the rural economy because most of the people in the rural areas do sell chicken to counteract minor needs like salt, sugar, even school fees for the children.
Tanzania launched its bird flu response plan in April with plans to spend some $29 million in government and private donor funds over the next 3 years. The aim is to focus on surveillance and early detection of the disease among the bird population on both Tanzania's mainland and Zanzibar. Dr. Mroso explains the plan's components.
The first one is surveillance for early warning, and then the second one is detection of the disease. That means capacity building of our labs. The third one is containment of the disease at source.
Government's efforts are now concentrated on making people aware of the disease so that any outbreak can be quickly detected and contained. Tanzania uses local government officials to educate local farmers about the plan. Joseph Mubana is a livestock officer in Temeke Municipal Council and advises farmers about good husbandry and how to avoid diseases that could affect poultry.
We use many ways to allow our farmer to be informed. First of all, we visit them in their farm, their poultry farm, and the other way we put posters in various places in order them when they pass through to read the posters and know about the diseases.
So far, Tanzania has not had any cases of avian influenza, and authorities say they are confident that the emergency response and preparedness plan will enable them to deal effectively with an outbreak of the disease. Herbert Were, reporting for VOA News in Dar es Salaam, Tanzania.
Well, so Lenore, as far as you know, what are the major challenges of dealing with bird flu in African countries?
I think first and foremost, we have to think about the communication aspect of it, as far as raising the awareness. A lot of people still do not even know that this disease exists, you know. When you go to the remote villages, to the farmers, they don't know. And some of them also do not even understand the implication of this disease. They think, oh, it's just a dead chicken. We can just eat it, boil it very good, and it will be fine. So I think communication is essential, and also resources. As it is true for bird flu, just like any other diseases. In a lot of countries in Africa, you know, it's a challenge to find the resources for prevention, and even in case some birds are sick, taking care of this bird, getting rid of them, and if there is human infection, how to treat the person who is infected. So I think these are the two challenges, resources and awareness.
No, I mean, chicken is a big deal in Africa. It's one of the primary staples there. Is there an alternative to eating chicken to avoid catching this bird flu?
Well, an alternative, you have to go to be a vegetarian maybe, or eat more fish. I think that when we talk about, people's diet, it's very difficult because you are used to a certain kind of food, and also you eat what you have. And a lot of time people have chicken running in their houses. That's what they eat. So how do you tell someone stop eating chicken, which is your main source of livelihood?
Nobody's going to stop eating chicken.
Exactly.
But you see, are you aware of any traditional way in which people used to handle things or diseases that appear to be like bird flu in chicken?
Well, disease like bird flu that is related to an infection of chicken, people will think, oh, if I cook it very well, it's going to be fine. Or if I put hot pepper, it's going to kill the virus. But, how effective it is. Yes, when you cook the chicken thoroughly, it definitely can help diminish the infection rate. That's definitely one way.
Very briefly, what are the symptoms, key symptoms that people should look out for?
Very similar to regular flu, which is a fever, headache, you get your temperature goes very hot. So sometimes it's very tricky to know that it's bird flu as opposed to any kind of regular flu.
Wow.
But the symptoms are very similar.
Thank you very much, Lenore.
Thank
you, Lenore.
Thanks to our health correspondent, Lenore Mudu, for joining us. So for more information on these stories, go to voanews.com/TV2Africa.